I personally think immunization is overrated. Why do I say that? Smallpox, polio, measles, whooping cough, and many other diseases have either been eradicated or are becoming less common than before. This was because of improvement in hygiene and nutrition. In fact, some of the diseases have started to become less common before their vaccine were ever made available. I wonder, do we need immunization at all?
Yes, improvements in living standards, hygiene, nutrition, and advances in medical care have played an important role in the decline of diseases such as polio, measles, whooping cough, and smallpox. But vaccinations played an even bigger and more important role in the decline of these diseases. Measles and whooping cough are not affected by living standards or standards of sanitation. The infection rate for both of these diseases is almost 100%, irrespective of social and sanitary conditions. While there has been a considerable reduction in the mortality risk from measles and pertussis over time, but there was no reduction in the incidence of these diseases before the introduction of vaccines. In some cases, the incidence of disease may actually increase as living conditions improve. For example, in developing countries, most people develop hepatitis A early in childhood, when the infection is usually mild or subclinical. In developed countries, where there is no childhood infection, adults are susceptible to hepatitis A, which is much more severe. If vaccination rates drop in Malaysia, we may see resurgences of these vaccine-preventable diseases. An example is when the MMR vaccine uptake dropped. Thousands of measles cases were documented, with many childhood deaths in the UK. With overseas travel becoming cheaper and more accessible, the need for all Malaysians to be immunized is increasingly important. Travelers can bring diseases that we have not seen for many years, such as polio, into Malaysia. Vaccine-preventable diseases do not discriminate. So ensure you're constantly protected and get vaccinated.
Actually, I don't mind immunization and even paying for it, but I've been told that it's not 100% effective. So what is the point of getting immunized if you can still get the disease afterward, right?
It's true that vaccines are not effective 100% of the time. Vaccinations are intended to stimulate the immune system so that it's able to recognize invading bacteria and viruses and produce antibodies to destroy or disable them, thereby preventing diseases. Fact is, there is a primary vaccine failure rate of about 10%, and some people do not respond appropriately to an initial dose of the vaccine, hence the need for more than one dose and booster doses. Take the vaccine, and you may still get the disease, but it's likely to be less severe. If we are able to maintain a high level of immunity within the community, we can keep diseases at bay. Some protection is better than none, so get vaccinated today.
人民相信細佬哥會被一啲細菌感染，就好似出水痘。我仲記得，當我出水痘嘅時候，我仲返學堂同我同學搞，因此我建立咗我嘅抵抗力。從此之後唔再出水痘，現在我唔再俾啲水痘感染嘅問題，而且好健康。我覺得我哋嘅細佬哥唔需要再打預防針。
You may remember your parents telling you that getting chickenpox when you were young was good for you. As such, chickenpox is not seen as a severe disease for children. What people are usually not aware of is that before the chickenpox vaccine was introduced, many children were hospitalized each year with serious complications, including pneumonia or infection in the lungs, inflammation of the brain, blindness, scarring, as well as severe skin infections. Even uncomplicated cases of chickenpox can cause children to miss a week or more of school and even miss important examinations. Vaccination for chickenpox typically prevents future infection with the disease. It helps to reduce the severity of the infection. So why put your child needlessly through discomfort and risk complications later in life when you can vaccinate them now?
You know, immunization is important for children because their immune system is weak. But we as adults, we don't need it. Our immune system is more well developed. Besides, we were all vaccinated as children. So of course, we are already protected. We can do without immunization. We're fine.
Vaccinating as an adult is as important as childhood immunization. Getting your vaccines helps protect your children as well. Some vaccines are not available for babies because they are too young. The best way to protect them from these diseases is to be vaccinated against them yourselves. For example, there is no influenza vaccine license for infants younger than 6 months old. There are also some vaccines that can only be given to adults. These are usually newer vaccines like the shingles vaccine or the human papillomavirus vaccine or HPV vaccine. The Tdap vaccine for tetanus, diphtheria and pertussis given to adults and adolescents will help prevent transmission to young babies who are too young to be given the primary DTP vaccine. So the next time you take your child for his vaccinations, remember to talk to your doctor about the vaccines and boosters that are available for yourself. Protect your children by protecting yourself first.
Okay, thanks for your comments today, Doctor.
Thank you.